How to tell the difference, cold versus flu. When you start feeling under the weather, it can be tough to tell if you have a cold or the flu. Both are contagious respiratory illnesses, but they are caused by different viruses. The flu is specifically caused by influenza viruses, while colds can be caused by various viruses like rhinoviruses and seasonal coronaviruses. Understanding the differences can help you take the right steps for recovery. One of the first things to notice is how quickly symptoms appear. Flu symptoms often hit you suddenly, while cold symptoms usually develop gradually over a few days. If you experience a sudden high fever, that is more likely a sign of the flu. Flu fevers can reach between 100 to 102 degrees Fahrenheit or higher and last for several days, especially in children. In contrast, fevers are rare with colds. Another key difference is how your body feels. With the flu, you might experience severe muscle or body aches. Colds may cause slight aches, but they are generally mild. Fatigue is another symptom to watch for. The flu often leaves you feeling extremely tired and weak, which can last 4 weeks. Colds may cause some tiredness, but it is usually not as intense. Both illnesses can lead to respiratory symptoms like cough, sore throat, and a runny or stuffy nose. However, colds are more likely to cause sneezing and a runny nose, while the flu may lead to a dry cough. Headaches and chills are common with the flu but are less frequent or mild with colds. When it comes to severity, flu symptoms are generally more intense and can lead to serious complications like pneumonia or bacterial infections. Colds are usually milder and rarely cause serious health issues. Typically, cold symptoms last about a week, while flu symptoms can be more severe and last longer, with fatigue sometimes lingering for weeks. If you are unsure whether you have a cold or the flu, testing can help. Special laboratory tests can confirm an influenza infection, which is important for timely antiviral treatment in some cases. Colds are usually diagnosed based on symptoms alone. If you notice sudden high fever, severe body aches, fatigue, and chills, flu is more likely. If your symptoms are milder with more sneezing and a runny nose, a cold is more probable. Both illnesses are contagious, so practicing good hygiene and avoiding close contact with others can help reduce the spread. Certain populations, including young children, the elderly, pregnant women, and individuals with specific medical conditions, are at higher risk for flu complications. If flu is suspected in these groups, seeking medical advice promptly is essential. In summary, flu tends to cause more severe, abrupt symptoms, including fever, aches, and fatigue, while colds produce milder, gradual symptoms mostly affecting the nose and throat. When in doubt, especially for vulnerable populations, consulting a healthcare professional for evaluation and testing is always a good idea.